My whole focus is to ensure that this place and other places like Cypress View keep going. But I also want to get the message out there about how important aged care is in small communities. My name's Karen Hodson. I'm the facility manager at Cypress View Lodge. If Cypress View wasn't here, the nearest aged care facilities are at least an hour away. Families no longer can see them on a daily basis. They can enjoy their last days here in the town that they built.
My name's Phil Coggins. I'm the business manager of Burrowa House. The satisfaction for me, I suppose, is helping those people. You can really see the difference that you make to the region. Being such a small community, you tend to go that extra mile, if you know what I mean. And you're not just treated like a number here. We've got two older gentlemen up there now. They've been mates since they were kids.
My name's Jocelyn Piper. I'm the facility manager here at Burrowa House. A lot of the staff that work here are local community members as well. The residents and the staff members build up a great rapport, and it's like having an extended family for the residents. A lot of residents in nursing homes have loved ones who are elderly, and travelling to visit them is not always easy.
We have a sign up in the staff room that we work in the residents' home. They don't live in our workplace. Families come and go as much as they like. There's no visiting hours here. We encourage independence. We want our residents to be as independent as possible, to have us here when they need their help. We're not locked. The residents can walk down the street if they want to. None of these things are on offer in bigger facilities.
There's a lot of big organisations out there that they come in, they take over a small organisation, it becomes a part of the bigger picture, and I guess it loses that sense of identity. It's community owned. We want to keep it that way, and that's one of the reasons why we're heading down the path of joining the co-op.
That's our whole philosophy of each of these providers that are involved, is that we are community-led organisations. We're all within about 200 kilometres of each other. We ended up focusing on what we call the Murrumbidgee Local Health District. We range in size, but we're all single standalone providers who are trying to meet the same requirements of some much bigger organisations who have a head office and things like that. At the moment, we're officially 6. They all have the focus of their own facility, which is super important. But in doing so, we want to help each other.
A co-op to me is a collation of different resources, and having them in the one spot where members can use those resources. I think it's a matter of not do we form the co-op? It's a must, because otherwise small facilities like this one, we're not going to survive.
So the biggest thing that we're really facing at the moment is finances. The funding just doesn't meet for providers, for us to meet the reforms that are in place. Whereas we're actually giving the best quality care that residents can ask for. But when it comes to meeting the standards, we may not do it the same as a 200-bed facility does, because we just simply can't.
They say to be a viable organisation, you need up to 30 to 40 beds. We're only small, we have limited administration resources, yet we are required to fill out the same documentation as a facility with 400 or 500 beds. By consolidating our resources, hopefully it's going to make us better off.
Human resources is a major thing. It's really difficult to get registered nurses in small towns. Recruiting staff is so expensive individually for facilities, but that's what someone sitting in the co-op could be doing for all of us.
The main benefits of joining a co-op is sharing ideas and potentially using the same services that we'll have within the co-op.
Initially, what it will do is will help us meet the standards, meet the reporting that's required for all of us, no matter our size. We can make it standardised across the 6 facilities, have one person gathering the data, providing that to the department. We can look at purchasing power. Obviously, when we're so small, it costs us a huge amount of money for software and all these supplies. Whereas if we went together as 6 facilities together and said to the suppliers, look, you've now got 6 of us, what's a better price you can give to us? One of the other major benefits is that we're all single voices on our own. And this cooperative allow us to be a bigger voice in a big pool and get this advocacy as well together.
When you talk to other facility managers and directors, they're all going through the same thing, or they've been there and they've done that. They've got helpful tips and hints for you.
If we can pool our ideas, pool our resources, then there's got to be some benefits out of that.
In the future means that we can continue to maintain small nursing homes in regional areas, which, like I said, it's really important.
So one of the biggest things that's come from this, and no matter where the cooperative goes to from now, is what we've got is a community, and hoping that this model may be used by other people around the country as well.